Dear students, Assalamu alaikum. In the last lecture, we studied about micturition and its abnormalities. The objectives of today's lecture are to learn about formation of urine, glomerular filtration, and determinants of glomerular filtration rate. Today, we start with the most important function of kidneys, which is to rid the body of waste materials, either ingested or produced by metabolism. Kidneys remove waste materials from the blood by excreting them in urine. Formation of urine, therefore, encompasses all processes which aid in this function. Urine formation begins when a large amount of fluid that is virtually free of protein is filtered from the glomerular capillaries into the Bowman's capsule. Now, most substances in the plasma, except for proteins, are freely filtered. So, their concentration in the glomerular filtrate in Bowman's capsule is same as in plasma. As filtered fluid leaves the Bowman's capsule and passes through renal tubules, it is modified by reabsorption or by secretion into the tubules. The rates at which different substances are excreted in the urine represent the sum of three renal processes. Number one, glomerular filtration. Number two, reabsorption of substances from the renal tubules into the blood. And number three, secretion of substances from the blood into the renal tubules. In this figure, the different renal processes are shown by numbers. Number one in the figure shows filtration. Number two, reabsorption. Number three, secretion. And number four, finally, the urinary excretion. Now, there are certain terms which will be used repetitively in the subsequent lectures. Now, each term has a specific meaning. Filtration from the glomerular capillaries into the Bowman's capsule, then reabsorption, secretion, and excretion from the renal tubules and into the renal tubules. So be very careful that reabsorption is different, secretion is different, and excretion is different. So these terms must be used very carefully, and they are used specially at special places. Coming back to the topic, for each substance in the plasma, a particular combination of filtration, reabsorption, and secretion occurs. The rate at which the substance is excreted in the urine depends upon the relative rates of filtration, reabsorption, and secretion. Now, there can be four ways by which kidneys handle processing of different substances. The first one, have a look at the figure on your right hand. The substance is being freely filtered by the glomerular capillaries. It is neither reabsorbed nor secreted. So, the excretion rate is equal to the rate at which it was filtered. And an example of such a substance is creatinine. Now, a second scenario is in which the substance is freely filtered by the glomerular capillaries and partly reabsorbed from the tubules into the blood. Therefore, the excretion rate is less than the filtration rate. And example of such substances include the various electrolytes such as sodium and chloride ions. Another method by which kidney handles the substance is when the substance is freely filtered by the glomerular capillaries and completely reabsorbed. Yes, completely reabsorbed from the tubules into the blood. So therefore, there is no excretion in urine. An example of such substances are nutritional substances such as amino acids and glucose. The fourth scenario is when the substance is freely filtered by the glomerular capillaries, there is no reabsorption from the tubules into the blood. Rather, the substance is secreted from the peritubular capillary blood into the renal tubules, in addition to what was first freely filtered. Therefore, the excretion rate in this case is equal to filtration rate plus the tubular secretion rate. An example is the organic acids and bases. Okay, I now begin with the topic of glomerular filtration, which is, as we have just seen in the previous slides, is the first step in urine formation. A very large amount of fluid, about 180 liters, are filtered into Bowman's capsule each day. But most of this filtrate is reabsorbed. The composition of glomerular filtrate is similar to plasma. However, it does not, I repeat, it does not contain plasma proteins, red blood cells, calcium and fatty acids. Glomerular filtration rate. Glomerular filtration rate is determined by the balance of hydrostatic and colloid osmotic forces acting across the glomerular capillary membrane. and secondly by the capillary filtration coefficient Kf. Kf is the product of permeability and the surface area of the capillaries. In the average adult human, the glomerular filtration rate is about 125 milliliters per minute or 180 liters per day. Now this is very often asked by the examiners, so you should be remembering this value. The figure shows the average values for renal plasma flow, that is equal to 625 milliliters per minute, glomerular filtration rate equal to 125 milliliters per minute, tubular reabsorption equal to 124 milliliters per minute, and urinary excretion equal to 1 milliliter per minute. Now the fraction of the renal plasma flow that is filtered is called filtration fraction. The fraction of the renal plasma flow that is filtered is called filtration fraction. The filtration fraction is calculated as follows: filtration fraction equal to glomerular filtration rate divided by renal plasma flow. It averages 0.2, which means that about 20% of plasma flowing through the kidney is filtered through the glomerular capillaries. Glomerular capillary membrane is the main structure through which the plasma is filtered. Now, as we studied in a previous lecture, the glomerular capillary membrane has three major layers: endothelium of the capillary, basement membrane, and epithelial cells layer made up of podocytes. The figure shows the cross section of the glomerular capillary membrane and its major components. Now, in the glomerular capillary membrane, the filtrability of solutes is inversely related to their size. A filtrability of 1.0 means that the substance is filtered as freely as water, and electrolytes and glucose are freely filtered. As the molecular weight of the molecule becomes nearer to albumin, the filtrability decreases. Negatively charged large molecules are filtered less easily than positively charged molecules of equal molecular size. The reason for these differences in filtrability is that the negative charges of the basement membrane and the podocytes repel the negatively charged molecules. We should be interested at this point to learn as to what are the forces that affect or determine the glomerular filtration rate. and these are known as determinants of glomerular filtration rate. The glomerular filtration rate is determined by the sum of hydrostatic and colloid osmotic forces across the glomerular capillary membrane, which gives the net filtration pressure and the glomerular capillary filtration coefficient. Therefore, as mentioned earlier, the glomerular filtration rate equals the product of Kf and the net filtration pressure. Now let's review the forces which gives us the net filtration pressure. Net filtration pressure forces include: number 1, glomerular hydrostatic pressure, denoted as Pg, and it promotes filtration across the glomerular capillaries into the Bowman's capsule. The second force is the hydrostatic pressure in the Bowman's capsule, Pb, and it opposes filtration from the glomerular capillaries into the Bowman's capsule. The third force is the colloid osmotic pressure of the glomerular capillary plasma proteins present in the glomerular capillaries, their colloid osmotic pressure pi g. It opposes filtration from the glomerular capillaries into the Bowman's capsule. The fourth force is the colloid osmotic pressure of the proteins in the Bowman's capsule, pi b, and understandably this pressure promotes filtration from the glomerular capillaries into the Bowman's capsule. Now this figure shows the summary of forces causing filtration by the glomerular capillaries. Now let's study these determinants of glomerular filtration rate one by one. Determinant number 1, glomerular capillary filtration coefficient, Kf. As we studied earlier, the Kf is a measure of the product of the hydraulic conductivity and the surface area of the glomerular capillaries. The Kf cannot be measured directly. Rather, it is calculated by dividing the glomerular filtration rate by the net filtration pressure. So, an increased Kf increases the glomerular filtration rate, and a decreased Kf decreases the glomerular filtration rate, However, the thing to note here is that the changes in Kf do not provide a primary mechanism for the normal day-to-day regulation of glomerular filtration rate. Some diseases lower Kf by reducing the number of functional glomerular capillaries and by increasing the thickness of the glomerular capillary membrane. These diseases include hypertension and diabetes mellitus, and therefore a decreased Kf will lead to decreased glomerular filtration rate in these disorders. Determinant number 2, Bowman's capsule hydrostatic pressure, PB. The PB increased will lead to a decrease in the glomerular filtration rate. Increased Bowman capsule hydrostatic pressure decreases the GFR. Bowman's capsule pressure can increase, causing reduction of glomerular filtration rate in conditions associated with obstruction of the urinary tract, like in urinary tract stones. And if such a situation persists, it will eventually cause distension and dilation of the renal pelvis and the calyces, a condition known as hydronephrosis, which can damage the kidneys also. Determinant number 3, glomerular capillary colloid osmotic pressure, pi G. As blood passes from the efferent arteriole through the glomerular capillaries to the efferent arterioles, what happens is that the plasma protein concentration increases because of filtration. Now, the reason for this increase is that about 1/5 of the fluid in the capillaries filters into the Bowman's capsule, concentrating the glomerular plasma proteins that are not filtered. The average colloid osmotic pressure of the glomerular capillary plasma protein is about 32 millimeters of mercury. The two factors that influence the glomerular capillary colloid osmotic pressure are, number 1, the arterial plasma colloid osmotic pressure, and an increase in this arterial plasma colloid osmotic pressure raises the glomerular capillary colloid osmotic pressure, which decreases the glomerular filtration rate. The other factor is the filtration fraction. An increase in the filtration fraction concentrates the plasma proteins and raises the glomerular colloid osmotic pressure, which decreases the glomerular filtration rate. The role of filtration fraction is quite interesting. Now, because the filtration fraction is defined as the glomerular filtration rate divided by the renal plasma flow, the filtration fraction can be increased either by raising the GFR or by reducing the renal plasma flow. So let's see what are the effects of reduced or increased renal plasma flow. A decrease in renal plasma flow tends to increase the filtration fraction, which would raise the glomerular, capillary, colloid osmotic pressure and tend to reduce the GFR. Now take some time here to understand this. For this reason, the changes in renal blood flow can influence glomerular filtration rate independently of changes in the glomerular hydrostatic pressure. The other situation in which there is an increase in the renal blood flow, it will cause a slower rise in the glomerular, capillary, colloid osmotic pressure and less inhibitory effect on the glomerular filtration rate, because a lower fraction of the plasma is initially filtered out of the glomerular capillaries. Therefore, a greater rate of blood flow into the glomerulus tends to increase the GFR, and a lower rate of blood flow into the glomerulus tends to decrease the glomerular filtration rate even with a constant glomerular hydrostatic pressure. Now you should read these determinants from your textbook because they are a little complicated and will slip from your mind if you don't revise them. There is an assignment for you. Draw a figure showing the summary of forces causing filtration by the glomerular capillaries. I have shown this in one of the slides in the lecture, and then you should submit the diagram with your handwritten name and roll number to your respective batch teachers.